you're going down this journey too, possibly. So I immediately came home, got on the computer. I'm looking at what are calcifications, what do they mean by suspicious, and all that. Obviously, they'll tell you statistically, um, 99% of the time it's benign, but there's always that 1%, right? And guess who drew the short end of the straw? Me. So after my ultrasound and my diagnostic mammogram, they said they wanted to do a biopsy of my calcifications, and there was a small lump in there as well. And so from that, they determined that I did have stage 0 DCIS breast cancer, ductal carcinoma in situ, which means I had cancerous cells building up in my milk ducts, but they were non invasive, meaning they're not spreading. So that was actually the biopsy was done on September 17th, 2024, which was my grandmother's birthday, her first heavenly birthday. And then 2 days later, they gave me the report that it was cancerous and or precancerous or however you want to call it, but they're cancerous tumors or cancerous cells building up inside my milk ducts that need to come out. So with the early detection, that's what they decide. Some women who have DCIS decide not to have a lumpectomy. Some women will go as far as having a mastectomy and have their total breast removed, and maybe even both so that they can match. I opted to have a lumpectomy and on the right breast where the cancerous cells were. And I happened to go to Northside Hospital, thumbs up, hands up, to Northside Hospital Cancer Institute. And my doctor, Dr. Jean Claude Schwartz, is phenomenal. He's also a cancer survivor. I think he had leukemia himself, but he's a breast cancer surgeon and a reconstructive breast surgeon. So when he goes in to take the cancerous cells out, tumors out, whatever you have inside, he will also reconstruct not one but both breasts so that they are twins and not distant strangers. Because want to be up here and want to be down there. So, so he makes sure that they're both at the same height, so to speak, on your chest. So I had that surgery November 7th, 2024, and today is November 28th, 2024. So it's only been 21 days, and I am still technically recovering because with reconstructive surgery of any kind on the body, you normally need about 6 weeks of healing. I have two major scars underneath my underarms, under my breast, where he had to pull skin or pull tissue from the underneath the arms to fill in the gap where he took the cancerous cells out and pumped my breast up. So I'm still healing from that. I can move. I can move my arms, as you saw, and but I had some drains on me coming out of my body, draining the blood and fluid and plasma or whatever was coming out for about 2 weeks. And once those were removed, my movement was less restrictive. With those drains, it's very restrictive. But so yeah, my journey picked up DCIS, and now it's been removed. But the journey's not over because we got to get rid of any potential for recurrence. So I have seen an oncologist this week. And well, first of all, let me just say that technology and medicine have grown so much where for DCIS and other cancers as well, types of cancers, there are lots of tests that they run to determine your level of risk. And even though I was stage 0 breast cancer, which means that they caught it quickly before it was invasive, the grade can be low grade to high grade. For DCIS, it's 1, 2, or 3, 1 being low, 3 being high. And mine was grade 3, high grade. And what that means is it's aggressive. It was more aggressive than someone else's DCIS on the low end. So mine was a little bit more aggressive. Um, and then also there's a test called the Decision RT, DCISION RT, Decision RT test. And I read my results. No one from the hospital even told me about this. I just saw it on my chart. And so I read my results, and the test ranges from score 1 to 10. There's some other oncology tests that are out for other types of cancers, but for DCIS, it's Decision RT, a primary test um, with a score of 1 to 10 to help you determine the likelihood of recurrence. And so 10 being the highest likelihood of recurrence, my score was 9.2. So very high likelihood of recurrence. And by very high, they break it down. If I do nothing, there's a 42% chance that I would get DCIS again. There's also a 20% chance that if the cancerous cells come back, it could be a higher stage. Then if I get radiation, there's a 15% chance that I get DCIS again. And I can't remember my score or the percent, but then there's also a certain percent chance that if it comes back even after radiation, that it could be more than DCIS. So I'm getting radiation. And I went into the oncologist's office and I said, I was going to demand radiation. And she said, you should. So she was in alignment and agreement with me that I should get radiation treatment. And, she's an oncologist, Dr. Bambra. And now she's referred me to a radiologist, which I have an appointment on December 10th for the radiologist. So then she will determine, because it's also a female doctor, female empowerment, that will help me determine the length of time I need for the radiation. For my research, they don't like to put anyone under radiation for more than 6 weeks. Some people can go as short as 1 week. So somewhere in the middle is what I'm expecting, 3 weeks, maybe more, because I do have a more aggressive, or had a more aggressive DCIS, which has been removed. And all my tissue around what they removed was clean. They call those the margins. So my margins were clean, meaning there were no cancerous cells in the extra tissue that they took out of my breast, which means they didn't leave nothing behind. No man left behind. The cancerous cells were taken out. But where did they come from? How did they form? Are they coming back? Or are there some new ones coming back? So to help minimize that chance, we'll be doing radiation. I also got pills from the oncologist, which I haven't started yet. She said I could wait till I do radiation to start the pills, which are like estrogen blockers. And so one of the tests that she ran to determine whether I need the pills, I'm like in the gray area. I can go without, I could take them. It won't hurt me, except there are side effects. So if I have major side effects from the pills, she told me I could do without the pills if I have major side effects. But if I don't have the side effects and I want to continue with the pills, then I can continue with the pills. I don't have the name of the pills in front of me right now, but when I do a follow-up, I'll bring you that name of the pills, or I'll put it in my comments area so that you'll know what it is I'm taking. Obviously, everyone's journey is different. Everyone's medication will be different, but this is what I have to go through to try to make sure I don't have, or to try to eliminate the risk of recurrence within the next 5 years or 10 years. I'm 54. I don't want a recurrence, at least not in the next 5 years. Let me have some peace for 5 years, even 10 years or beyond. I hope it never comes back. So we're doing what we can to make sure it never comes back. But I do have a high risk of recurrence. I think on average, the risk of recurrence for most DCIS patients is about 1%, 1 point something percent. And mine with radiation can at best be 15%. So I'm 15%, I'm 15 times more likely, I think, I guess you say it like that, to get a recurrence than the average DCIS patient. So in addition to the pills and the radiation, I am going back to healthy eating. Now, of course, I eat small meals because of my gastric bypass and my stomach being really small, but I haven't been as healthy as I should be. And I'm a bacon holic. I'm a saltaholic, and I'm a bacon holic. I love bacon. I remember back in the day, in my 20s, 30s, or something, I ate a whole pack of bacon for breakfast. I love bacon. I remember when I was a teenager working at Burger King and I worked the morning shift and was making bacon, or I might have been working the afternoon or evening shift. I don't remember, because they have bacon all the time. But I love bacon so much, I was eating the bacon. Don't tell them. When I worked at Burger King as a teenager, because I love bacon. And bacon wakes me up in the morning. When I was a little girl, my mom would cook. She doesn't even eat bacon, at least not pork bacon, because she doesn't eat pork. And but that will wake me up in the morning, bacon. Since I had surgery on November 7th, 2024, and today is November 28th, 2024, I have not eaten bacon. It's processed meat and it needs to stay out of my body. Now, of course, the doctor is like, very good, but you can have it once in a while. But I know me, it's like a junkie. I just got to go cold turkey, so to speak, no pun intended. I guess I can't even really eat turkey bacon because it's processed meat. I can't eat deli slices, it's processed meat. So I'm doing what I can little by little, day by day, to improve my eating habits. I bought salad ingredients. Walnuts are good for me. I didn't buy a whole lot. Avocados good for me to eat. Spinach, of course, I love. Mushrooms, I love. So I make that. I had the egg omelet with that this morning. So again, I'm doing my research on foods that are better for my body. I will not be vegan or vegetarian. I love chicken and other meats and seafood. So I will continue to eat them, but I'm going to try to stay away from processed sugar, processed meat, and as my oncologist said, processed sugar. I really don't eat a lot of sugar either. I do, but not as much because it does upset my stomach after having had gastric bypass. For example, when I drink water, I always use Crystal Light, which is not processed sugar. But some people tend to think, oh, that's Crystal Light is causing cancer. Well, no, they've done a lot of research on it, and it really doesn't cause cancer any more than anything else will cause cancer. So they really don't know what causes cancer. There's lots of factors for a lot of people, environmental, social, economic, whatever. Uh, there's lots of factors that are involved. There are people who have been vegan all their lives, or most of their life, or most of their adult life, and they still get cancer. There are people that stay away from refined sugar or processed sugar, and they still get cancer. There are people that eat like crazy and they get cancer or don't get cancer. But so there's really no rhyme or reason as to who draws the short end of the stick. But once you do handle it the, the best you can, the best way you want to, there are people who don't want to go through radiation, don't want to go through chemo. Thank God I wasn't prescribed chemo. But I personally am not afraid of the radiation. I mean, there's so much going on in our environment now. What is a little zap around my breast going to do, Um, and so I'm going to do what I can to counter that radiation. I'm going to drink more green tea. I'm going to drink more water. I'm going to walk and stay healthy. I'm going to stay away from refined sugar and processed meat. Processed sugar, processed meat. Um, so I'm doing what I can to prolong my life, to reduce the risk of recurrence. So that's my update. So the next step is actually next week. I have a follow up with the surgeon um, to check on my healing process, and then the week after that is the follow a consultation with the radiologist. So that's my update. If you have any questions, concerns, comments, please leave them for me. And happy Thanksgiving.